Hey, this is Jeremy, and today we're going to be talking about the initial assessment of your burn patients. This initial assessment is really important because it's going to help dictate how aggressive your treatments need to be, and it's going to kind of help establish your treatment plan for what you need to kind of take care of first with your patient. Always remember that your safety is paramount and your patient's safety. So whenever your patient actually makes it to you, whenever you get your hands on your patient, remove their burnt clothing. Get it off of them and stop the burning process. Stopping the burning process is important because as your patient's out of the fire, their skin, their tissues have absorbed so much energy that it's continuing to burn even after it's been removed from the fire. It's the exact same thing as if you were to take vegetables or you were to take steak or any other meat off of a grill or off of an ice from being cooked. You remove it from that, place on a plate, it's still continuing to cook as it sits there because that tissue, that it's absorbed so much energy that it's continuing to try to give it off, get it away, and it's doing that through cooking. Now, so you need to remember to assess your patient's airway initially. Do they have soot around the nose and the mouth? Look in the back of the throat. Is the back of the throat black? Is it charred? Can you see skin kind of peeling away? If so, then your patient likely has an airway burn, especially if you see that burned tissue in the back of the throat. You need to be assessing your patient for stridor, which is going to be that upper airway swelling, and you need to assess their level of consciousness and what is their mental status like, and what is their O2 saturation. If their O2 saturation is continuing to drop, they're going to need oxygen. You should never withhold oxygen from a burned patient. And if they do have that airway burn, be sure to give them humidified oxygen. The way that you can accomplish this is you can give them nebulizer, nebulized normal saline. Throw it at 8 to 10 liters, and what that's going to do is that's going to be giving them adequate amounts of oxygen, and it's also going to be kind of cooling off the back of their throat as their throat and their airway comes in contact with that normal saline that you put in that nebulizer. Assess their chest wall. Do they have chest wall burns? Is it circumferential? If you have a circumferential chest wall burn, as that tissue begins to harden and loses elasticity, it's not going to be able to move as well. And so this is going to impede your patient's breathing. They need to get somewhere as soon as possible and to the correct place where they can kind of treat that. There is going to be an escharotomy, and they're going to actually remove parts of the skin and allow for that chest wall movement to occur by getting rid of, or by causing a break in the tissue. If you need to manage your patient's airway, only be aggressive with an intubation or supraglottic airway if absolutely necessary. Because if you do, you've severely changed their clinical outcome. Try to maintain them with humidified oxygen, non-rebreather, as long as possible. But if you can't manage their airway, if your patient can't manage their airway, then obviously you have no choice but to intubate or to obtain that airway through other methods. Be wary of face and neck burns, because even though it doesn't necessarily look like they may have airway burns, at that point, the face and the neck, those tissues underneath the skin, they can actually start swelling, and they can lead to an airway compromise. So be sure to assess deeply for those. Look at their vital signs. One of the vital signs that's, I believe, is very important and a lot of people overlook is actually going to be your pain scale. Whether this is the Longsbacher face scale or this is a scale of 1 to 10, 10 being the worst pain you ever felt, 1 being nothing at all. What do you feel? Because if you have a patient who rates their pain 10 out of 10, and you're continuing to allow them to stay at that pain, that's not necessarily going to be beneficial to your patient. It's just kind of contributing to the psychological factor of I just got burned, and you could be leading to a negative clinical outcome. So manage your pain if it's available to you, and you need to get them to the appropriate place. If you have a child, they may not necessarily understand anything yet, so you need to keep them calm. You need to kind of speak with them, and again, just kind of help keep your patient stable as best as you can. Assess their blood pressure and their heart rate. Is their blood pressure low and their heart rate high? If so, then they're going to be in shock, and you need to treat it accordingly. Lactated ringers is going to be the preferred fluids for burn patients, and we can talk about that in a different video. Is there SpO2? What does it look like? Give them oxygen. Make sure that your patient is getting the right oxygen the right way. Again, that humidified oxygen is very vital. It is very key in managing those airway burns. Obtain your IV access. Yeah, you want a large bore IV, 18 gauge, 16 gauge, 14 gauge, and you would typically want to put them in an upper extremity. If you can put it through burn tissue if you need to, but it's not preferred, and it's preferred to go through that non-burn tissue. But if you don't have any non-burn tissue where you have vascular access, then there's not much you can do about it. And obtain those bilaterals and start that fluid resuscitation. We're going to use that fluid resuscitation. We're going to kind of gauge that off of your estimated total body surface area burned, or it's also known as TBSA. So assess that. You can use your rule of nines and kind of use your Parkland burn formula, or your consensus burn formula, to start that fluid resuscitation. Because the things that you don't do in the field, they're going to have to do in the hospital, and they may not be as successful due to the tissues may start swelling, and they're going to have a harder time doing the things that you were not able to, or you did not do in the field. So always remember that your safety is paramount. Stop the burning process and remove your patient's burned clothes. Assess their airway. Look for the soot around the mouth of the nose, and assess for those airway burns. Give them humidified oxygen and manage their pain. Ensure that you're getting that pain scale, and ensure that you're obtaining those other vital signs such as your blood pressure, your heart rate, and your SpO2, and obtain that vascular access. You may have a better opportunity in the field than the hospital would due to that tissue swelling that is going to occur. So these are all the key things that you need to keep in mind for your initial assessment of these burn patients.